My name's Guido Allegretto. I'm live half the year in Pittsburgh, Pennsylvania, and half the year in Myrtle Beach. And I'm a retired Navy veteran, submarine force. About 3 years ago, I had a meniscus on the inside of my right knee that flipped upside down, so I went in, of course, and they just took it out. So now I'm just sitting on bone. And they tell you, just bear the pain as long as you can, and then we're going to give you a knee replacement. So anyways, about 3 years into it, I was going to look into doing that, and I met a friend that told me about the spine center down here, and I said, well, I'll check it out. So I had a little consultation, and the doc said that I'm bone on the inside. He measured it, did everything, and he said I can help you. So anyways, I said okay. This was a Thursday of this year before Memorial Day weekend. And I also told him that I had a slip in my back, an S5L1 slip. And the Navy was going to slide that back, plate it, and screw it. And that's when he told me that would probably be the worst thing I ever did. And I told Doc, I said, well, maybe not the worst, but top 5. That's just a little joke. But anyway, so he had me stand up in his machine there, and he looked at my back and he showed me everything, and he got down to where that was, and he measured. He says, this is 24%. It's basically a level 1 to going to be a number 2, but I can help you with that. He says, do not get the plates and the screws and that with the Navy. Don't do that. You won't need it. So I said, okay. So it's Thursday. So Friday I walked into the office the very next morning, injected my knee. You can watch it if you want on the screen. Put the knee 3-4 minutes. That was done. Then I flipped over my back. He did both sides of that to build cartridge in. I had 0 cartridge, so it was just a pain level 9 to 10 daily. And that's where the point where I was at there. And I had a limp with my knee, and pretty rough shape, 61 years old. So he did both injections in my back. You can watch it on the screen if you want. If you don't, it took like 5-6 minutes. So in 15 minutes, basically I was done and walked out of the office pain-free. At that point, I was pain-free. He told me I needed to just take it easy for a couple days. That was my recovery time. Just take it easy for a couple days. Don't pick up any freezers or anything. So that's what I did. And so 6-7 weeks later, I could basically kick a football right now. My knee is like phenomenal, but the recovery and everything else. I mean, you're still going to be a little sore, but nothing like I was. I walk up steps, I can walk around, I can walk again, I can do stuff again. So now I can get a little active. My back, let's face it, I got a slip. I'm going to have pain. I'm maybe at a 3 to 4, sometimes 2, but never over a 5 on my lower back where I had the problem. So I'm good to go there. And basically he said, let's let it fuse naturally right there, and you'll be good to go. So that's where I'm at with that. And I tell people about it all the time. But the way I look at it is like health, money. So, I mean, if I'm healthy, I can make money. So I'm very happy with it. The staff here at the medical center is just upbeat, positive. You feel at home. Just really, really comfortable atmosphere to be in. And I wouldn't be doing this if I really didn't feel that good, because I usually don't go on TV or anything like that. But it is a great place to be. Great place. Oh, great guy. I'm not just saying it because he's Italian. I am too. But yeah, great guy, professional, nice guy. He'll just really work with you. I mean, everybody at the staff just works with you, just friendly, positive, and you can actually talk to people here when they're not trying to push you out the door as fast as they can. So yeah, yep, Dr. Mike Ambagorda is just a nice guy, professional, got a sense of humor, got some common sense. You don't find that too much. So I'm pleased with everything here. Hey, major surgery. By the time you have surgery on a knee, my buddy behind me, he had surgery back in February, had a new knee put in. I told him what I was doing. On Thursday, I told him where I was going. On Friday, I'm walking around the yard bending over, picking stuff up, and he called me over. He goes, hey, Guido, what are you doing? I said, what do you mean? He goes, why are you bending over? Why are you walking right? I said, I just had stem cells 2 days ago. I said, I feel great. He goes, and he's walking around like Frankenstein after 4 months. 5 months of a knee surgery, and he has therapy and everything else. He's just struggling. You know, some people I guess it works good for and some doesn't, but I haven't had a problem, and it's like no downtime, none. So I'm good. And if this is the way to go, I was told by somebody else, thank God by that actually had it done here too. Yep.